Good afternoon and welcome to today's webinar on mental health, creating an effective organisation approach. Today's webinar will be presented by our special guest, Alistair Dornan, who is the Director of Organisational Wellbeing at Gallagher's. I'm Katie Stothard and I'm a category buyer in corporate and financial services here at YPO. Now, before I pass you over to Alistair, you will have received this presentation as a recording. And so if you've got any questions, if you want to please email me and I will forward them on to Alistair if I'm unable to help. We'll respond to all questions as soon as possible. Now over to Alistair.
Well, thank you for that introduction, Katie, and thank you everybody for joining and taking the time to watch this recording. When Katie and the team approached me saying, could we pull something together to support particularly public sector with mental health, first and foremost, I was delighted to be able to lean in and give some insight. But secondly, I really felt this was, if ever there's a right time to be helping organizations to talk about mental health and supporting the people, then hey, it's got to be right now. We've all been through and are still going through a pandemic. We've seen huge changes to the workplace. Indeed, you can check the artwork that's behind here. When we were first trying to do this, I was in an office. I'm now working back at home. And that's affecting millions of people across the UK and in very, very different ways. Mental health itself, when we begin to talk about some of the solutions, mental health is a really challenging topic to get into. And it is important to share that while we are talking about mental health more broadly, if you are affected by any of the issues, please make sure that you do get in contact with any of the support that's provided by your employer. Don't need to suffer on your own. Right, that's my introduction. Let me give you a quick overview of who we are and why I've been asked to speak with you guys. So we're Gallagher Benefit Services. We principally support organizations from a consulting perspective on employees, employee benefits, and the whole HR agenda. We're part of quite a large organization called Gallagher. That's an insurance and risk broking expert family organization. Been around for about 90 odd years, which is a fantastic business to work with. And it was great to have the opportunity to support YPO today. Principally, in my world, the teams look after 4 key areas, which is outlined those we have. First is culture and leadership. And my goodness, we've been busy with that over the last 18 months, I can tell you. Reward and benefits, particularly as organizations begin to rethink talent. And I was watching the news this morning, some of the significant stretches that are taking place into our supply chain in the UK because of a talent scarcity in certain roles. If I had my time again, an HGV driver is probably about the perfect role right now because they're in huge demand. Employee communications, something that throughout the pandemic has proven to be a real challenge for organizations. How do you communicate effectively with your people when they're not in offices any longer? And of course, that has consequential impact on individuals' mental health and how they access support. And then finally, my own world, I lead a team who specialize in organizational well-being. And don't let the well-being piece throw you. We don't do the mung beans, the gym membership, and the lentils. We're all about the hard end of how do you support performance of your individual, your people, your leaders, and your business or your organization to try to better. It's great, loads of fun. Anyway, today, what are we going to touch on? Well, I'm going to share, so we'll break the session down into 3 areas. We'll probably do about 30 minutes. And then, as Katie said, please do write through with any questions if you have them. I'd be delighted to respond to those personally for you. Broken the session down into 3 areas. The first, I'm going to talk to you about some of the legislative consequences for organizations and things that you could do very much, rather than talk to you about theory, what I'm quite famous for is making sure that I give you practical support that you can then take into your organization to change the way that things happen. So first up, we're going to talk about legislation. We'll focus a little bit on the health and safety executive. Bear with me, though, it does get quite exciting. We're then going to talk about managing expectations. I want to share with you some of the big trends that we're seeing in the UK right now that are impacting the way that people feel about work and actually helping you to maybe predict some of those challenges before they hit your organization. Finally, again, so that you can have some practical support, I'm going to share with you a wellbeing strategy framework that will enable you to develop a game plan. Because do you know what? It amazes me. The vast majority of spend in mental health and more broadly wellbeing in the UK actually achieves very little. Doesn't reach the right people, doesn't engage with people, doesn't connect with them, doesn't change behaviours. And certainly the framework will help you to make better use of your existing spend in the wellbeing space. So hopefully a useful 30 minutes investment of your time. So let me get going. Let me touch first up on the legislative responsibility. And this has been really fascinating to watch over the last 18 months. We as employers, you are dialing in, you're bound to be an employer in some way, shape or form, or indeed an employee, more likely you're probably both. We have a legislative responsibility to meet and support our people. And actually the vast majority of organizations don't comply with health and safety legislation. I just want to pinpoint the 3 areas that are really important for you. So as an employer, right now, it's critically important you have 3 compliance steps in place. The first is a stress audit. Have you conducted a stress audit in your organization? Set up by the health and safety executive. Every organization needs to have one. It doesn't need to be at an individual level. It can be at an organizational level, and it should focus on the stress management safety standards that the HSE have set out. Quick Google, they'll be able to pull that up for you. Super simple steps to follow. If you haven't got one, get it in place. Shouldn't take you too long to do. Second is, based on that audit, you should have an organization-specific action plan. Don't need to publish it, but you do need to have an action plan in place. And that's the steps that you're going to take as an organization to improve or close any gaps that you've identified when you begin to look at your own mental health provision and the causes and consequences of that. And then finally, and this catches out so many organizations, you should have a standalone stress policy. Whenever I get to speak to HR directors, they kind of scratch their heads. You know, we've got an absence policy, or we've got a return to work policy, or we've got a well-being policy or suicide policy. You need to have a stress policy. Again, really quick Google search. You'll pull up some of this, the standards are there. Health and Safety Executive have done a brilliant job in putting all of their content online. You can see that gov.uk. Have a play around, get that information. You may even find that there's someone in your organization, depends on the size of your organization. You may have someone who has responsibility for this, but do take some time after this call to check. This is why I think it's important for you to check, are you compliant as an organization? You see, mental health is, as I mentioned on the slide, a very complex issue. And it impacts people in very different ways. And it can have quite big consequences for individuals. Now, mental health itself is something where people on the whole don't seek help. They don't seek help because of stigma. I'll touch on more of that a little later. The stigma prevents people from accessing the support that you as a responsible employer will have in place. You know, most employers these days have some form of access to counselling or therapy or even mental health first aiders. There's a lot of support available. People don't access it in an appropriate and timely manner. Why don't they do that? Because most people don't recognize that they have a mental health issue until it is too late. Now, here's the part that matters for you as an employer. Mental health is a protected characteristic under the Disability Discrimination Act, which means that any claims are uncapped, potentially uncapped. So, unlike other claims that are subject to a maximum cap, some of these are open-ended. Now, if you're a clever employment lawyer, and I did happen to do this, apologies if any of you dialed into another webinar that I did with a legal firm, I did with their partner, and the partner said he loves when he gets a mental health related claim through, because he just asks 2 questions. First, can I see your stress audit, please? And when the organization scratches their head and says no, a second one is, well, how large a check are you prepared to write? Now, it's a really simple way for you guys to protect your employees, but also to protect your organization. Get those 3 legislative responsibilities to take. Get a stress audit in place, get an action plan, and have a stress policy. From my perspective, following the health and safety is a great starting point. Sorry, following the health and safety guidelines is a great starting point for any organization to make sure that their people feel different about work. Particularly the last 18 months, we've seen mental health related illness significantly increase. I saw some stats from Bupa and from Unum, 2 big insurance players in the market, in the UK marketplace, but they've seen demand for their mental health related services increase by over 30% in the last 18 months. We know that a big driver of mental health is financial uncertainty. Financial well-being, financial stress is a significant contributor to individuals' mental health. And don't forget, mental health is not just about workplace stress. It's about the overall health of an individual's from a mental perspective. Sorry, I got a bit tongue-tied there. When you look at financial well-being, we know that 21 million adults in the UK have been negatively impacted by the pandemic, whether that's through furlough schemes, job uncertainty, redundancies, a range of other topics that could have been needing to make amendments to their property, all of that. 21 million adults, the Financial Conduct Authority believe, have been negatively impacted by the pandemic. Of course, we know that's going to be driving further spikes in mental health related illness, particularly from the workplace. And of course, if you're not seeing that through increased levels of stress, if you've got reporting tools, brilliant, or absence, or more recently, and you may have seen this, I know Katie, you and I were talking about this when we last spoke, the Great Resignation. At the moment, if you can't be a truck driver, you should be in recruitment, because it is the hottest ticket in town, with people deciding to leave their organization and go and join others. And certainly when I'm speaking with HR directors, recruitment and retention are probably in the top 5 priority list for every single employer. Anyway, that was a quick overview on the mental health legislative responsibility that you have as an organization. Super simple for you to fix. Get an audit in place, get your action plan, and develop a stress policy. And if you can get that done by the end of this week, you'll be completely compliant. Anyway, let's move on. I want to share with you guys now some trends that are radically altering the perception of employees. Now, when we talk about mental health, remember, it's not just about that workplace stressors or the change in the working conditions. People have seen a manifest shift in the working environment in the last 18 months. And indeed, I was on a call earlier on today where I was talking with a client who said, actually, we've invested millions in our new offices because it was a showcase campus to get people to join us. It really was a differentiator for us as an organization. And frankly, it was all wasted because people aren't coming back to the workplace, so they don't want to come back to the workplace as it was before. And we've got to rethink. And organizations across the UK, in fact, across the world, are rethinking the purpose of the working environment, all of which have consequences for people. Don't get me wrong. One of the big pluses for me in the pandemic has been I got rid of a £6,500 a year train habit. I'm not commuting 4 hours a day any longer. And I'm able to invest that time on wonderful things like I get to take my kids to school in the morning. I'm not sure if they're that happy about it, but I certainly like the change it's brought to me. But anyway, let me talk to you about some of the trends that are impacting decision-making for people leaders in the UK and more widely right now. The first is digital experience. I'm more than happy if you want to get copies of these trends, drop a note into Katie and we can get you an overview of the entire state of the sector research paper. All of this is having a consequential impact on mental health and well-being. Particularly noticeable are organizations that are getting the digital transformation right. Now, normally if there's a live webinar, I'd be asking you to raise your hands and talk to me about your digital transformation journey. And most organizations are on some part of that journey from, we don't really do much in the way of digital to, we are fully digitally native. Taking your people through that journey actually drives a lot of uncertainty for individuals. Am I going to lose my job? What does my future, my workplace look like? Do I need to reskill? When was the last time I was skilled? Have I been trained properly? You get the idea. But ultimately, what's been fascinating, and particularly why I wanted to raise this trend for you, is that our people, on the whole, moved to being digitally native over one weekend in March 2020. In fact, in one weekend, we achieved more than any chief technology officer in most organizations has done in probably the previous 10 years. And it's something that shifted expectations for your employees. We're certainly seeing this through research and practical examples with clients. Your people now have a much deeper engagement with the digital ecosystems that your organization has or doesn't have, and it's raising expectations. I'm already seeing that fold through into conversations with people who do join organizations. How do you engage? Do you use Zoom? Do you use Teams? What clever collaboration solutions have you got in place? Because do you know what? I won't be going back to work in an office the way it was before. So this first trend around the digital experience, I think, is really significant, because for a number of organizations, that shift, well, it's not stopped and it's not going to stop. And it's really important that you are able to capture and understand what's great from a digital perspective for your people and make the right investments. Second trend that has really come to the fore, digital experience is one of the major. Certainly the second is the employee experience. Now, I've positioned that there. Is it a buzzword? Is it something that's just being framed? Interestingly, when looking at recruiting talent, particularly millennials, that will change, of course, as populations get younger. But particularly looking at recruiting millennials, they're not interested in how you do things. They're not interested in the long-term strategy of an organization. They're interested in your purpose. What are you there for as an organization? What do you do? How do you communicate it? How do you front up from an environmental perspective? What does it mean for them? What are they going to get? What does their experience look like? And do you know, that shift has caught so many employers by surprise, because we're very used to saying, I am such and such an organization. This is how much I'm going to pay you, and come and work for us. And people would come. Actually, now there's another couple of trends. There's a micro trend in here as well, which I think is really important. The boardless workforce. I've just recruited. Let me illustrate that with the points. I've just recruited 2 outstanding people into one of my teams. One of them works in France. Sorry, lives in France. I have got no policy or procedure for somebody who works in France. So we're having to write it, because they're boardless, right? They can do their job brilliantly, I might add, but they can do their job from anywhere on the face of the planet. And that whole opportunity for me to tap into talent in completely different countries. I've never got somebody to travel from the Loire Valley up to London before, but now I can have that individual tapping in to my teams on a regular basis, on a permanent basis as an employee. But that boardless workforce has changed things. That employee experience, we have had to completely rethink what the employee experience looks like, both wherever our people are based. And why is that important from a wellbeing perspective? When we think of wellbeing solutions, I'd be interested to get the views of the audience at some point, but when you think of wellbeing solutions, they tend to be, and I did cite this earlier on, they tend to be at that mung beans, the gym membership, the lentils, the practical steps that are built upon people being based in an office or in a campus environment. Your wellbeing initiatives really now need to be able to be consumed digitally and anywhere that your people are. But rethinking your purpose and communicating your purpose really supports that recruitment and retention agenda that we know is causing no end of problems for organizations right now. Let me touch on the third trend that I actually think is driving some of the most uncomfortable levels of mental health spike in the UK right now. Combining the last two, it's change. And it's thinking about that change in the context of not just the last 12 or 18 months, but probably the last 3 years. And the pace of change that people are now seeing over the next week, 2 months, 6 months, 12 months. Businesses, organizations are radically different today than they were just 18 months ago. And your people are caught kind of right in the middle of that. Oftentimes when I'm working with HR directors, change isn't fully thought through. It's delivered. We maybe deliver a training program, but we tend to not be able to embed change well enough within organizations. And again, look to your own organization. Think of the major changes you've implemented over the last 12 months, maybe those that you're planning to do again. What does the return to work look like for your organization? How are you managing that and communicating that to your people. I mentioned about employee communication earlier on. You know, a really interesting dynamic, which I think has driven an increase in mental health, is at the beginning of the pandemic. I don't know if it's the same for your organization, it's not the same for a lot of clients I've been working with. The chief executive stepped in to tell the story, to take control, to take command of the crisis situation, and started to own the vast majority of the communication. That meant that his or her message was the only message that a lot of people heard. Consequence of that for a lot of organizations is that middle management, line management, were left out of the equation. And their role at being able to support people through change was subsumed into a broader, louder communication narrative that was probably less personal. From a change perspective, it's super easy for organizations to be able to rethink how they support their line managers to have informed conversations. In fact, I'll let you into a little secret. There are loads of mental health interventions available. Just Google other search engines available. I realize I've told you to Google 3 things now, but there are other search engines available. Go and have a look at mental health interventions. There's everything from apps on your phone to books to walking clubs. Goodness, there's loads of mental health interventions available at your fingertips. Biggest challenge is getting people to use them. And the single most effective intervention, time and time again, there's loads of research on this topic. In fact, it's one of the few interventions that consistently returns a 19% reduction in absence. Let me just leave that one with you. 19% reduction in absence, mental health related absence. It's training your line managers. If you can train your line managers in mental health, even if that's a really basic program of awareness, doesn't need to be mental health first aid. In fact, I'll talk more maybe about that later on. If you can train your line managers to be better at more awareness around mental health and impact, how to have the conversation, that's the critical bit, how to have the conversation with people, you'll see a significant reduction in long-term absence. Now, kind of makes sense when I explain to you why, because the number one reason, as I mentioned earlier, for people not accessing support is they don't want to feel like a failure or admit that they have a problem. That's the whole stigma piece. But if you can enlighten your line managers and empower them, because actually a lot of people, we're human beings, we want to reach out and help people. But line managers kind of struggle because they haven't got a playbook. And what happens if that person does actually say they need help? I'm going to have to do something about it. Actually, training your line managers gets rid of all that. And the reason I mention that is because from a change perspective, line managers are your front line in supporting any of the big changes that have taken place in your organization, any of the big changes that are going to take place in your organization, and in reaching out to support your people. The final trend is one of insight. And, you know, it amazes me and interests me just how little employee feedback gets through to decision makers in organizations. I mean, maybe you'll have, I'm sure some of you will have an annual employee engagement survey. We certainly do at our organization, and probably like many, many hundreds of other organizations dialing in or listening to this. We probably get a report at the end of each year and some changes are made, and then that's it, it's kind of put away again, right? But actually working with insight, turning that feedback into powerful action for your people really makes a difference. And at the moment, we're at the most insightful period in human history. We have more data, more insight, more trends, more analysis on our people, from sentiment through to behaviors, through to performance. We're awash with it. The big issue is, how do you harness that data? And one of the points I want to pick up, there's loads that you can use insight for, but why this really interests me with this growing trend is that if you can harness the power of your employee data and insight and turn it into meaningful change, you can dramatically improve engagement in mental health solutions. Again, mention with stigma, mention with challenges. Most people, I'll share actually a very quick example. Most of you will have some form of counselling service available. It's one of the most commonly used interventions in the UK, sometimes called an employee assistance program. Generally speaking, it'll be an online support service or a free phone 0800 number that gives you access to counselling. Do you know that nobody calls an employee assistance program to tell them they're having a good day? And the reason nobody calls is we make it really difficult for people to access support when they need it. Point is that when you need support, the last thing on your mind is, where's the 0800 number that I got given when I joined the organization? They don't do that. So people actually find themselves on a mental health journey. They go further and deeper than they should do, and they don't get access early enough. So the majority of mental health related issues that present themselves for counselling, well, had they presented themselves at an early enough stage, they would have had significantly better outcomes. And that can have big consequences for your people, their families, the communities that you serve, if you can get that right. Now, insight is incredibly powerful. And from an organization perspective, I would really encourage you to start thinking about the insights that you can get from your employees. Have a chat with HR, have a chat with the various teams and functions that you've got, and find out ways that you can begin to identify more effectively the mental health journey that your people are on. Some organizations have actually used mental health questionnaires that go out to people or staff. I'm in kind of two minds with that. I think there are more effective ways that you could capture the viewpoint of your people. Questionnaires, you'll tend to get 20, maybe 30% participation, and they'll be those who've got a point to prove or to tell you, but you're not going to get the whole picture of your organization. So start thinking quite deeply about how you can capture insight to make better decisions. Right, my final piece, I just want to shift away from the shifting trends that are impacting people, and to give you something that you can take away. Take a screenshot, feel free to use this. This is the cornerstone of almost all the work that I do with clients. I will tend to get clients come on board at 2 points, particularly from a wellbeing perspective. The first is, and actually surprisingly common, is we've been doing this wellbeing thing for a long time and it doesn't work. Now, that most organizations will have some form of wellbeing program in place or have some mental health related support. I'm just broadening this bit here to be wider than mental health. And most organizations at some point will then question where the value is coming from. And I'm sure you'll have had some experience with those walking to work programs, or the Mondays, the gym membership, the lentils, the launch of a new, yoga or lunch program or whatever. It's quite common for organizations to be really intervention heavy. The reality is most of those interventions don't improve the lot of your average employee because they're not relevant for them. It's not personalized. They haven't used insight, all those bits and pieces we mentioned. In fact, you can split your population into 3 groups. And this is a really helpful hint, actually, when you start to look at participation rates. So you've got 20% of your population. This is just kind of broad brush human nature. About 20% of your population get the message, understand it, they're switched on, they probably make good personal choices. They're what we call the well, right? They're good. If you were to put any program, they'd sign up for it because they want you to tell them how good they are or how fit and healthy they are. So if you do measurement and testers, you always get a 20%. They're your bankers, right? They're switched on to all the messages that you have in place. The other end, you've got the 20% you're never going to reach. They have lifestyle choices that are ingrained. You're never going to get them to, for example, stop smoking, look after themselves. It happens, right? There's a 20% of the population that are never going to land your message. The real key group, and this is where this framework comes in to support you. The key group is that 60%. That's your battleground. That's 60% in the middle who, do you know what, you could influence and you could change their behaviors. Problem with an intervention-led approach is you're never going to reach that 60% because they aren't aware enough to go on that journey themselves. Hopefully that makes sense. 20%, you're 20% at the bottom, you're never going to reach. You get 60% in the middle. That's the 60% that we really want to be targeting with programs and interventions. The strategy framework helps you to do a number of really important tasks. The first is planning. So when I work with clients, I mentioned earlier on, we get clients that come to us because they've tried wellbeing and it hasn't worked and they need to rethink. Or we'll get other clients, tend to be a little less, who will say, I haven't done any wellbeing before and I want to get it right. Very rare do we get clients like that, but we do have them coming through. So for those of you that have been doing wellbeing or mental health related interventions for a long time, you'll probably have got a wellbeing calendar. It amazes me the number of organizations have wellbeing calendars. Like in March, it's National No Smoking Day. Then there's a Lung Foundation Day. Then there's Cancer Awareness Day, and then there's Mental Health Week, and there's Suicide Prevention Day. Actually, it was just last week, maybe the week before. And you have National Love Your Colon Month, and there are thousands of days that are set aside, and these intervention-heavy programs generally will be supported by charity, which is great because you get a lot of free resources, and it's a great, good quality content that you can share with people. Or NHS do some wonderful content. The issue is it doesn't reach that 60% of your organization that need help, whether that's from a wellbeing or a mental health related perspective, is broadly speaking the same. So when I'm working with organizations, we use this framework to help you move away from intervention heavy, the thick end of thin things, and move towards something that's planned, considered, and relevant. Quick whistle stop tour. Starting at the top, when I'm working with organizations to get it right, start with some objectives. What are you looking to achieve? And be bold with your objectives. I want to reduce mental health related absence. I want to reduce the impact of stigma. I want to improve recruitment and retention. I've got to solve X, Y, Z. Look, whatever your objectives are, get those written out and make sure that they're bought into, particularly the business case and the parameters that they're bought into by senior leadership in the organization. Otherwise, do you know what? Your interventions won't carry any gravitas. They won't have any stickability. That's what I'm looking for. They're not going to have any stickability. And you'll find that you'll be back to interventions in no time that will be meaningless, and a lot of resource will be thrown at the wrong end of things. So start with objectives, set out your aims, make sure you're engaging with stakeholders, working your parameters. And why is that important? Because, well, as we move over here into the left-hand side, we'll look at measures and creating a house view. It amazes me the number of times that I sort of unpack programs for clients, and they haven't really got a clue what they're trying to solve. And I'm a big believer of you should create a house view. You should choose 3 or 4 areas that you directly want to influence for people. Really important to do that. I've just used 4 examples here. So career, emotional well-being, physical well-being, financial well-being. I mean, they're no-brainer, right? Those are probably 4 most important. Really important to choose what you will work with so that you don't get drawn into the things that aren't relevant, and you will get pitched to left, right, and centre. I mean, we do not want for providers in the UK. There's always a new startup. I'm constantly getting pitched to in my role with the latest and greatest mental health intervention or wellbeing program or talking therapy or goodness knows what else. Right? There's loads of them out there. Understand what it is that you're focusing on so that you don't focus on absolutely everything. Then get some clear metrics. Again, really surprising me the number of organizations that don't start with data. Remember that trend about insights. Get your metrics in place. Understand where you are, where you want to get to, and then quantify the gap. I've given you some examples here with our maturity matrix. Love using maturity matrix because actually it helps you to really define what the art of the possible looks like. Let me give you a quick example. If we're talking about mental health, the vast majority of mental health has got nothing to do with work. The vast majority of mental health is baggage, positive or negative, that people carry with them. They have full lives, they have families, they don't have families, they have diverse issues, complex issues, and work is just one of those elements. So understanding where you can improve the lot of people from a mental health perspective is really important, because you're never going to be able to improve the argument I had with my 15-year-old son first thing this morning to get him out of the house to go to school for the 19th time this week, it feels like. personal sharing there, maybe a bit of overshare. But you can begin to influence the way that you can control those elements that you're responsible for. Get your metrics, understand how you can pull maturity together, and then really begin to identify where your gaps are. Because you understand where your gaps are, it makes this middle bit really easy. And you can read through it, but I really encourage organizations to start with some simple assessments for people, give people the choice to determine where they are with that. Whether it's a stress audit, for individuals, and there's a lot more cool ones that are out there, better named than that. But you again, use Google, you'll find those. The one I really wanted to call out for you, because usually at this point in a webinar, people are scratching their heads going, God, this sounds really expensive. Actually, far from it. If you've done all the work I've mentioned so far, you see that bottom left-hand corner of that middle box, it says provider ecosystem. You would be amazed at what you have available for free that can positively influence mental health. If there's anybody here from the blue light services, you will have a significant range of resources available to anybody from the NHS. It's amazing the quality content that you have available within the NHS, and it's all available for everyone really. Make sure that you take advantage of all of those free services within the context of your framework first and foremost, because do you know what? They're as good as anything that you'll be paying for. Finally, on the right-hand side, I like to work with clients then on how you can build in behavior change. Remember that group of 60%? That's your battleground. Well, if you can begin, if you understand through the insight what's driving their behaviors, you can begin to support them with behavioral change programs. And that's when I really encourage organizations to then rethink their calendar of interventions. So get away from the kind of the national no smoking days, blah, 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 but make it relevant for your population and for your people. And then and only then when I begin getting into targeted interventions for your groups that require it. So anyway, let me recap. We've touched on 3 areas today. The first is the legislative responsibility. Why is that important? It's important because over the last 18 months, we've seen at least a 30% increase in demand for mental health related services. I think that presents risk for organizations. It's risk where we are likely to see more claims. In fact, we are already seeing more claims coming through. Those claims will tend to be uncapped because of the Disability Discrimination Act and the protected characteristics of mental health. They're also really likely to get pushed through because any employment lawyer worth their salt is going to ask to see those 3 things. Remember those 3 legislative responsibilities you got. Get a stress audit done for your organization, get an action plan in place to tackle the gaps you identify in your stress audit, and then produce and publish a standalone stress policy. If you do those 3 things, well, you're well on your way to creating an environment that's safe from a mental health perspective. And then touched on the trends from the digital experience and how that's dramatically changing the way that people are engaging with the workplace. We talked about the importance of change and why that change curve is just a constant, and it's quite suffocating for people. It will be driving huge mental health challenges, coping mechanism challenges in your population. Again, that's significantly shifting that 3rd trend around employee experience. And as I mentioned, that 4th trend, which I think flows really beautifully into the strategy framework, which is the insight. What insight do you have on your people, and how is that informing the decision-making that you take around any of your interventions? And finally, we closed out with the strategy framework, which I just love putting that in place with organizations, because you begin to see huge change, positive change, I should say, taking place in a short period of time, and actually reducing your cost and driving improved effectiveness. So there you are, Katie. Quick whistle-stop tour on mental health and how organizations can do more, ideally, with less.
Oh, Alistair, I've really enjoyed listening to you on that. I'd like to thank everybody for joining today's webinar, especially Alistair for supporting us with this. Have a lovely day, everyone. Bye.